All right, we're back at CDSF with the next episode of PT to the Gym. I'm Pat with Suarez Physical Therapy.
This is Mike with Capital District Sport and Fitness.
And Dan with Capital District Sport and Fitness.
So this time we're going to be talking about low back and low back pain specifically, and we're going to do a series on low back pain. So today we're going to talk about when you get pain with extension. So when you bend backwards, it's going to put you in what's called a flexion bias, meaning you want to flex forward to get out of that pain. And today I'm going to talk a little bit about recreating core stiffness, re-engaging some of those muscles that disengage when you have some of this pain. And then Mike and Dan will take over.
Yeah, and we're going to talk a bit about how you can kind of maintain some of those patterns that Pat is going to bring you through when it comes time to train in the gym, whether that's getting back to your squats or your deadlifts, how to adjust those to kind of cater more towards that flexion bias so we can be using the right muscles and kind of stay pain-free while training those movements that you like to live.
And this is going to emphasize a little bit of our beliefs in terms of back pain, in that we believe in loading that tissue up again in order to get it back to where it needs to be and to get you out of pain versus lying down and taking a break.
And a lot of the times, people encounter any type of pain, but especially back pain, is kind of fall into this kind of fear avoidance pattern. And now since I'm hurting, staying away from some of these things that once we're pain-free, now we're causing you some pain. We want to help you today kind of work through building back to gradually getting back to doing those things that you like to do.
Right, so let's get into it. And we'll start with me and some of the rehab exercises that we're going to go through. All right, Pat with Suarez Physical Therapy here with Mike from CDSF again. And first, what I like to do is take people through a basic pelvic tilt. And all that is just rounding through that low back. So you see Mike here, he's nice and relaxed. He's got his knees bent, feet flat, hands right on that pelvis. And all I'm going to ask him to do is rock that pelvis back towards the table to kind of flatten his back into the table. Now sometimes this can be a little difficult for someone to feel, so if you have a small washcloth, you can take that, slide it right underneath the back, use that as a cue to try and smush that washcloth down into the table, and then you're going to hold that there for about 5 seconds. And you'll notice Mike's core really engages there, and then I want him to relax. So as he gets this movement down, he's able to rock that pelvis. We're creating a little bit of lumbar flexion there, which is the bias of movement that we want to move into. And then relax. And he's engaging that core every time he tries to do that. Now, once he gets good at that, what I'm going to have him do is called a curl up. He's going to straighten his left leg. He's going to keep his right leg bent. Now, it doesn't matter which leg is bent unless you have pain in one leg. If you have pain in one leg, keep that leg bent, okay? So he's going to cross his arms across his chest, hands on his knees. He's going to tuck his chin in towards his chest, and I'm just going to have him gently lift his head and his shoulders off the table. Good. And notice he's not very high off the table, shoulders aren't very high off the table, but his core is now engaged, right? So this is just putting a little more load into that position where he's trying to maintain a neutral spine, and he's engaged through that core. Good, and relax back down. Now this time I'm going to have him breathe through this one, okay? So he's going to do the same thing. He's going to curl up. Again, he's not too high. He's contracted here. Now he's exhaling through that rep, and then back down. Good, relax. Now, if these are difficult, you're going to start off holding 3 to 5 seconds for about 5 reps. As they get easier, we'll work our way up to about 10 seconds. Now, these can get pretty easy quickly, so if they do, then we'll move on to more advanced movements. All right, it's Pat with Suarez Physical Therapy here with Dan from CDSF. And next movement I like to go into is a dying bug. So we're going to show a couple of progressions of the dying bug to increase the load as we go. So we want to start, Dan's on his back, his feet are going to be up in this tabletop position, hands are up, and we're engaged in that core. So we've already learned from the pelvic tilt and from the curl up that we've got this core on, we've learned how to do that, we've learned how to keep that spine in a neutral position. So now we're going to start loading it a little bit. So we're going to have Dan do, we're just going to start with the leg, and use this one so you can see it. He's just going to keep that knee bent, and he's going to tap his heel to the ground and back up. So this is kind of the easier variation here. And it's just getting Dan to learn how to load and move through his leg while maintaining that contraction. Next, we're going to keep that knee bent, but we're going to use the arm. So we're increasing that load across the core a little bit, across the front side of that core. By keeping that leg bent, that arm's not going all the way back. And then the last one is to go fully out. So we're going to straighten that one, yep, and then back up and in. And this one's going to put the most load across the front side of that core. So we're working to keep that spine in a neutral position, be able to feel that back, keep that core engaged, and we're gradually increasing that load across the anterior core. Good. Another exercise we like to use is this supine resisted march. So we give a little bit of load to the feet. Dan's gonna engage through that core again, and then he's gonna march one leg up. He's gonna hold it for a second here. That's gonna give us that little bit of flexion, and again, engage the anterior part of that core. So now we're working on core as well as that hip flexor. Go ahead, back down, and then back up. You can alternate, yeah. So again, you see him engaging through there, right in through that flex position. That's again, increasing the strength through the front side of that core with using a little resistance through that resistance band. This is gonna prepare us back for running, jumping, box step ups, box jumps, anything like that that we're moving back into the gym. Good.
Hey guys, Dan here with Capital District Sport and Fitness. We got Pat from Suarez Physical Therapy. And we're going to talk a little bit about anterior core. Pat talked earlier about creating core stiffness from a supine position. Once you mastered that ability or regained the ability to create that core stiffness and get those abs working, we can go to some more advanced exercises to further challenge the anterior core and prevent some of that extension and anterior hip tilt that you'll see with people who are going to have some back pain there. So the first exercise we're going to go through is a stability ball rollout. So Pat's going to go down. He's got two knees on the ground here. We're using a pad. We want to be straight line from knee all the way to the head here. He's going to squeeze his butt and get those hips tilted. Think about pulling the ribs towards the hips to get those abs engaged, similar to what Pat talked about with the curl-ups. From here, he's going to have his arms out straight on the ball, and he's going to roll out. He's going to roll out, let his arms come out. His hips are going to come with him. Everything's going to be a nice straight line, nice rigid piece here. Then he's going to push back in, get those abs working, and come back up. When we talk about the stability ball rollout, when you first try this, only go out so far as you can control the abs and the hips in this scenario. Because there's two mistakes that we will see when it comes to the stability ball rollout. So the first one is going to be going out into that rollout and getting way too much extension through the low back. And he's going to go out further than he should be. And now you're going to start to see his low back dip down and you see that extension. We want to avoid that. So start out with some smaller movements in that stability ball rollout. The next one we'll see is someone who's not quite strong enough, and they'll kind of go out and they're going to leave their hips behind without bringing their hips with them. So now instead of an ab exercise, we're not really getting any core tension here, and the hips are just in a flex position. So then we're going to get back up. So we're going to keep those hips tilted underneath, butt squeezes, keep that nice rigid piece, and then the hips will come back all at the same time. Once you've mastered the stability ball rollout, we're going to go to a TRX fallout. So this is going to be on our feet. So we're going from a kneeling position to on our feet. It's going to be a similar mechanism to the stability ball rollout. We're going to work that anti-extension, but now we're going to have a bigger range of motion to work through. So again, Pat's going to get set up. He's going to be on the balls of his feet here. He's going to pull those ribs down towards the hips, get the abs engaged, butt squeezes. Straps are going to be out in front, and now he's going to reach out towards the wall in front of him. And as he does, same thing, hips are going to come down while keeping that core tight, and he's going to come back. Same idea here as with the rollout. We can really adjust the difficulty by how far out we go into shoulder flexion and how far forward we go. We can also move the feet back further to create some more difficulty with the TRX fallout. He's going to reach out, and he's going to come back. Now, with the TRX fallout, you will see similar mistakes as we do with the stability ball rollout, making sure we keep those ribs down towards the hips and the abs engaged and the butt squeeze in. Make sure that we stay in a good position for both the stability ball rollout and the TRX fallout.
Oh, good. This is Mike and Dan at CDSF. And right now we're going to talk about a push-up. Now when you're dealing with back pain, you're likely going to be cleared or feel more comfortable training your upper body before you get to your lower body. But that still doesn't mean you should kind of neglect some of these principles we're talking about while you're training your upper body. And the push-up is a very common upper body exercise and a very common example of people having a tendency to fall into their kind of old habits of overextending that low back while performing an exercise. So Dan's going to get set up in a push-up right here. And first, I'll have Dan show you what a few reps look like. if you fall into that bad habit. So you'll see now to start, Dan was first in this good position where the hips are tucked, he feels the abs working, and he has a nice straight line, hips up to his head. Now what a lot of people have a tendency to do is to lose that, have the hips roll forward, and you start to sink through this low back. And all of a sudden the rep is going to look like this. Our low back's diving to the floor, which will put our shoulders in a position that it's going to be a little more at a disadvantage. So instead, think about going back to that plank position. Straight line hips to head. You feel the butt squeeze a little bit. You feel the abs working. Again, you have the abs working right here. And then let's take it really slow on the way down. Make sure you keep those abs working during the whole push-up. And then push away from the floor. Just as you're lowering down, keep in your head that your abs need to be engaged. And when your arms straighten out, just go through this checklist. Are my hips tucked? Yes. Are my abs working? Good. And then go down into the next rep. So remember, just because it's your upper body doesn't mean you shouldn't be aware of some of these positions that you want to reinforce to keep you healthy and pain-free.
So as we progress, we want to move into some of the movements we're going to be doing in the gym. So as we go through, what we like to do is we like to get a small weight. We're going to keep it in a goblet position, right? So we're going to front load this movement. So we're going to do a goblet squat. So our feet are going to get about shoulder width apart. We're going to hold on to that kettlebell, keep our elbows in. We're going to slowly go down into that squat, and then we're coming back up. Now, the key here is to think about what we learned in the curl up and the dying bug. We want to maintain that core stiffness by engaging those muscles that we learned how to use again in the curl up and the dying bug. So we're going to re-engage through here. Elbows are going to be kept in. Weight is right in front of our chest. We're coming down into that goblet squat and then back up. And this is really to get our back and our muscles ready for the movements we're going to start doing back in the gym.
This is Mike and Dan at CDSF, and Pat just showed you some of his favorite anterior core drills. They're drills to build stiffness and strength in the front side of your core to help you kind of get out of that extension posture that you like to be in that may be causing you some symptoms and pain. And then he brought you through that goblet squat where we start to talk about how we can load in that front position, start to train our legs while staying in this more flexion biased position where we alleviate some of our symptoms. Now the next step is going to be getting back to the barbell. What you may be used to doing is back squatting. So Dan's going to set up right here in a back squat, and we're going to unrack it out of the rack. Now when we have this load placed behind our body, it's going to put you in a position where it's going to be harder to control this extension. You're going to have to work more to kind of get this rib cage down and get your spine to neutral when this weight's behind you. Now if you're having some pain or you're weak already in the abs, you may have a really hard time, especially under load. So Dan, let's rack it back in right now. Now one simple change you can make to start to build back your squat is switching to a front load. So taking that bar and now placing it in the front side of your body. And Dan's going to get set up with this cross grip that we'll use a lot right here. But now when that weight is placed more forward, it's going to help facilitate more ab work for you, help you get that rib cage down, control the abs, and be in a more neutral position with your back while you're squatting. Now if Dan goes through a few reps, he's going to be able to focus on those things Pat talked about, engaging the abs, and having the weight kind of work in his favor versus working against him in that back load. So next time you're building back your squat, you've kind of mastered the goblet squat and that weight's become easy, try first working on that front load before you go into the back squat. This is Mike and Pat at CDSF, and right now we're going to talk about lunging, how you can apply some of those same principles about developing good stiffness and using that stiffness in your core while performing the lunges to make sure you stay out of that extension posture that may be giving you some trouble. So Pat's going to grab these two kettlebells, and we're going to go back to that front load. So when we're loading in the front, it's going to put you in a position that's going to bias that flexion a little bit more. You're going to be able to engage the abs, keep your spine in a more neutral position. And right now, before we lunge, you want to make sure that we can feel those abs working like a plank or like your rollouts that Dan just did. So Pat, can you feel the abs doing work right here? You want to make sure you maintain that feeling the entire time. Now Pat's going to go into this lunge, and you're going to see in this one, Pat's going to stay very upright, which is all fine, but if you're experiencing some extension-based pain, it may cause you to fall back into some of the same habits where you start to lean back in that lunge. So Pat, let's move back to the start right here. Let's make sure we rehab those abs working again. Pat, you can feel the abs right here. And now what we're going to do is we're going to have a slight lean forward, that lead knee while you lunge. And what that's going to do is help you load into that hip a little bit more, prevent you from falling back into some of that extension, and allow you to use that lead glute to push you back to the start. So let's push back to the start right here, Pat, and let's go through a couple more. So Pat has his abs working, and then Pat, when you push through that right heel, can you feel that right glute kind of pushing you back to the start? So remember, during our lunging, think about going back to that front loading, making sure you have this checklist in your head that your abs are working and that you have a slight lean over that lead leg to help you get into that hip and use those muscles to push back.
All right, thanks for watching. That was our episode on flexion bias movement if you have low back pain. And so just remember that kind of our take on it was that we really want to load the spine and create that core stiffness again in order to get you moving. We really don't want you to rest and lie down and try and just let it get better. The best thing for it is going to be starting to reload that tissue, starting to get used to movement, re-engaging those core muscles again.
Yeah, making sure that you initially get a proper diagnosis so you can get back on track as quick as possible. Because back pain is all going to be a little bit different. And like we talked about wanting to have that flexion bias today, you want to make sure that you're incorporating the right exercises for your spine and for you to build back to what you need and be able to stay pain-free over the long run.
And remember, as you're getting back into working out and exercising after experiencing back pain, remember not to just jump into the most difficult core exercises you've ever seen right away. Build up from the bottom, work your way to the more difficult exercises. Start with creating that good core stiffness and work into things like fallouts and rollouts, and then some loaded lower body exercises and carries as you progress through your rehab or just trying to be pain-free.
And like Dan said, we gave you a handful of exercises here, but there are a variety of exercises that you can use based on what Mike was saying, your back pain. So, if you like what we're giving to you, check us out on Instagram. There are other recommendations there, and then check us out for the next episode, which we'll talk more about if you have an extension bias movement.